pledge to $13.5 million as our commitment to solidarity and sovereignty to the people who are affected by this spread of Ebola on our continent. I call upon all leaders to maintain or increase their pledges, and all those who made pledges at the last meeting to convert them in full and into cash, into medical countermeasures or technical assistance, whichever one is preferable. With no vaccine or antiviral, every day that transmission continues unchecked, the human cost just rises. The West Africa Ebola epidemic we experienced demonstrated that delayed action can transform a localized outbreak into a regional and a global crisis. That is why our response must focus on breaking the transmission and stopping Ebola at its source. However, our public health measures are being thwarted and weakened by the volatile environment in which the response is being undertaken. As political leaders, we can help by creating safe corridors for the passage of those people who are transporting goods and those who are providing services. We must seek a ceasefire to allow the Ebola response to proceed unhindered. We must continue to strengthen cross-border collaboration in this regard and act together. We must expand rapid diagnostic testing, contact tracing, and community awareness. We should be concerned that we have no biotechnology in our arsenal against the Burundi strain of Ebola. While we welcome and unreservedly support the efforts of Gavi, CEPI, and others, Africa cannot depend indefinitely on external markets and production systems during health emergencies like it happened during COVID-19. The response to Ebola, therefore, cannot end when this outbreak ends, as it must end. This moment must become a turning point. As African leaders, we must accelerate investment in local manufacturing, strengthen the African Medicines Agency, and we must also operationalize the African pooled procurement mechanism. African manufacturers must have predictable markets, and African countries
we call him Molly too.
Access to life-saving products in emergencies. We must all take heed of Africa's CDC's stance against imposing blanket and unsubstantiated travel bans. So I call upon African financial institutions, development banks, philanthropies, and African private sector to join governments in this whole effort of fighting against the spread of Ebola. I call upon our continental partners to continue to stand with Africa in a spirit of solidarity and mutual responsibility. We welcome the bold actions being undertaken by the World Bank to free up capital for the response. We call on all financing institutions to be as flexible and understanding in this hour of need. Our countries, as a continent and as a global community, our actions must be evidence-based, scientifically sound, and mutually accountable. The world will not be safe from Ebola until we have eliminated it everywhere. And when we do eliminate this threat, which we surely must and will, we must intensify our efforts to build a resilient global health architecture that will safeguard our people now and into the future. This is the time for action. This is the time when we must respond against this pandemic that is spreading. And all of us have within us the ability to do so. I thank you, and thank you so much for giving me this opportunity.
Merci beaucoup,
Brilliant.
Cyril Ramaphosa, pour votre déclaration. À présent, je voudrais inviter le docteur Jean Kasseya, directeur général de Africa CDC, pour nous donner un bref aperçu épidémiologique et une analyse de la situation concernant la flambée d'Ebola. La parole est à vous.
Merci beaucoup, Son Excellence. Je vais, sans perdre du temps, vous faire une présentation de la situation épidémiologique sur notre continent. Cette présentation, nous l'avons intitulée « Ebola, opportunité pour la sécurité sanitaire et la souveraineté en Afrique ». Avec votre permission, je vais parler en anglais qui me permettra d'aller un peu plus vite. Your Excellencies, you will see that this is the map.
Excellence, vous verrez que
This is the map in the eastern part of
la
DRC.
carte
You can't even know
de la partie
where is
est de
Uganda,
la
where is
RDC.
DRC, where is South Sudan, because all of these people are
Alors,
together.
nous ne pouvons pas distinguer la RDC et
Today,
le Soudan du
we
Sud.
are discussing this issue that is a
Aujourd'hui,
continental issue for us.
nous
Ebola is
débattons de
not
cette question
only
qui est continentale pour nous,
a virus, it's also a threat
due
to
au
our
virus.
economy, our trade.
Ces virus également constituent une menace pour notre économie. Nous recevons de l'écho. Pas pourquoi.
Okay. I was saying Ebola is not just a virus.
Je
It's
dirais que
also a
Ebola
threat to our economic growth, to trade, to tourism,
n'est pas seulement une menace
mining,
pour notre
cross-border
croissance économique,
commerce,
le tourisme,
even political
l'extraction minière,
stability, I
le
can
commerce
say
et même
instability,
l'aspect politique,
and also lack of confidence from investors.
et cause
Let me
également un
just
manque de
quote
confidence pour
General
nos
Winston
investisseurs.
Mbadi, who's the Minister of State Trade of Uganda, who declared
Alors, je m'arrêterai ici au ministre du Commerce de l'Ouganda, qui nous a dit que l'Ouganda est un numéro 1 de destination en matière de commerce dans la région. Si la frontière est fermée aujourd'hui entre l'Ouganda et les pays voisins,
This is why, as President Ramaphosa was saying, we need to stop this outbreak today or so quickly.
nous devons donc stopper la propagation de l'épidémie.
About what is the current situation that we are facing.
Nous allons parler de la situation actuelle à laquelle nous faisons face.
194 deaths, and let me remind you that the information we have provided
Nous avons des dettes et nous allons vous dire que l'information, les informations que vous allez recevoir datent du mois de juin.
23.4% of the case fatality rate.
33% des coûts de mortalité
with 10%, and every day
sont enregistrés et chaque jour nous avons des cas de mortalité.
We have a number of countries that
à ce jour, nous
are
avons un bon nombre de pays qui sont au risque, comme le Burundi, le Rwanda et d'autres notre pays à risque. Donc, nous devons nous rassurer que ce virus ne va pas se propager dans cet autre pays.
Where we have more than 97% of all cases.
Et comme c'est le cas en RDC, nous avons près de 914 cas.
This slide and the second one will show you how serious is this outbreak.
Alors, ces diapos vont vous montrer comment est-ce que le virus évolue.
When we took a photo 21 days after the declaration,
nous avions pris une photo 21 jours après la déclaration et nous nous sommes rendus compte que 681 cas ont été rapportés, mais nous faisons la comparaison avec le taux des cas du Burundi. C'est presque 6 fois ce que nous avions eu en
Week 3, this Burundi outbreak was already the third outbreak, Ebola outbreak, if we compare in terms of number of confirmed cases out of the 21 outbreaks that we know. But more importantly, Your Excellencies, we all know what happened in West Africa. We all know what happened in DRC, in the eastern part of DRC in 2018. But if you take a photo 3 weeks after the declaration of all of these outbreaks, this current one is coming first with a number of confirmed cases and number of deaths. But more importantly, today we are the 16th of June, and His Excellency decided to call for this meeting almost 1 month after the declaration. When we take a photo today and we compare with all of these outbreaks, you will see that this current Burundi outbreak with the 827 cases and 94 deaths is becoming first more than the West African Ebola outbreak, more than the Eastern DRC outbreak. What is the message? If we don't stop this outbreak very soon, it will be even worse than what we had in West Africa and in the eastern part of DRC. While we have a lot of concerns about what is happening in the East, in Ituri, I wanted also to remind Your Excellencies that in Africa CDC, working together with WHO, we have a huge concern on what is happening in Goma. I provide data that is summarizing that just in 1 day, this is yesterday, you'll see number of confirmed cases in Goma and number of deaths. Currently, Goma has huge increase of cases if we compare with the average in terms of number of people who are reported. Goma has the highest case fatality rate, almost 64%. And Goma has the lowest follow-up of contact list. That means we don't know what is going on in Goma. Without a major and a clear focus in Goma, maybe Goma could become another epicenter of this outbreak with a clear threat to other provinces of DRC and other countries. Excellency, this is the most important slide of my presentation today. This is the slide that is helping us to know if we are making progress or we are not making progress. Just to summarize for you, when you are in an urban area where there are some huge activities, mining activities, trade activities, we are considering for each confirmed case of Ebola around 40 contacts. Then, knowing that we have 827 confirmed cases. The contact list we are expecting must have around 33,080 people. Currently, what do we have in the contact list? Only 6,470 people. That represents less than 20% of people we are expecting to have in the contact list. Out of the 6,000, we need to achieve at least 90 to 95%. This is the WHO standard for the follow-up of these people. What it means, Excellency, when you have people in the contact list, it means these people were directly or indirectly in contact with someone who's positive. You need to follow them for 21 days. After 21 days, if they don't have any symptom, then you can release them. But if they have symptoms, then you have to test them, because we cannot test proactively Ebola. If the person doesn't have symptoms, the test will be negative. The test becomes positive only when the person becomes sick. This is why we keep these people under contact list in isolation for 21 days. You can imagine, out of 33,000 people we're expecting to be in the contact list, we don't know where are more than 26,000 people. We don't know. Second, out of these 6,470, we are expecting to have 90 to 95%. We are only following up 4,112 people. Overall, with the expectation to have 33,000, we are just following 12% of our people. This is a major indicator for us. It means we don't know the magnitude of this outbreak so far. The day will change that. It will give us hope to say when maybe we can stop this outbreak. Second, we have also issues regarding safe and dignified barriers. You can imagine, out of 98 cars we're expecting in Ituri, to do that, we just have 7 cars. And you saw in news, you saw in TV, how sometimes we have issues because we don't have all of these materials we need. And we don't have teams. We are expecting to have 540 people doing that. We just have 84. Let me summarize, Your Excellencies. Next time when President Ndayishimiye will call for a meeting, the only slide I will present will be this one. Currently, we will not win if we don't reach all of this contact. Second, we will not win if the case management is not adequately conducted. We need people to be admitted to hospital. We need people to be isolated. If this is not the case, we are facing a major challenge. Third, we need, knowing that being in contact with bodies of people who passed on is a way to transmit the disease, we need to have capacity to conduct safe and dignified barrier. Currently, we just have 14% of our capacity. And the last one, it's about the behavior change. We need people to trust what the government and what health authorities are saying, and also to adhere on the message. These are the 4 challenges that we have today, and these are the 4 challenges where we need to focus. This is the funding that we are looking to make sure that we can reverse this trend very soon. Excellency, you are here because it's a moment of a choice. This meeting is about you choosing what kind of Africa you want. If we decide to continue business as usual, it means to depend on the imported tests, vaccines, and everything. If we decide to wait just for partners to give us money, if we decide to wait to see how our countries are punished with travel restrictions, we will not win with this outbreak. But you have also an opportunity to say we need our health sovereignty. It means we need to accelerate the manufacturing of our health products. Africa CDC, we have the mapping in Africa who is doing what where in terms of vaccine, medicines, syringes, everything. We need also to accept today as Africa to come together. This is our continent. Let us do like European countries. They decided to have a pool procurement mechanism. They decided to have a European Medicine Agency. We need also to move. You already, Your Excellency, approved the African pool procurement mechanism. Let me tell you that yesterday I was in Cairo, Egypt, signed to be part of that. We are expecting all of Your Excellencies attending this meeting to ask to sign to be part of the African pool procurement mechanism. This is the only mechanism that will help us to procure our own products and to make sure that we are following the FCFTA agenda. Excellency, we are not looking for charity. We are not looking for charity. Today, you will see in this graph, we are just asking 518 million. If we don't have it, in the next 4 weeks, we'll not ask again for 518 million. We'll be asking about $1.5 billion. If we delay that, in the next 1 to 3 months, it will be $7.5 billion. What is the message? The message is clear. If we don't invest today with clear action to target all of these weaknesses we are talking about, will be responding to an outbreak that will cost a lot of money. As an example, the outbreak in West Africa, Ebola outbreak, the cost of this outbreak was $53 billion. And these countries, they lost, I'm talking about Guinea, Liberia, and Sierra Leone, they lost 12% of their GDP. Do we want to see that again in Africa? Do we really think that investing $500 million is not what we need to do? This is the question that we have. But we are also telling you, if you invested that, the return on investment is $1 will bring back $7. It means we are building our health security, we are building our economies, we are also building our sovereignty agenda. Excellency, before moving to my last slide, I wanted to show you some hope. This outbreak started without vaccine, without medicine. And the next slide that you have, maybe, because I have it in my screen, will show you the effort that we are doing in terms of medical countermeasures. It means vaccine, medicine, and diagnostics. I don't know if others it's moving, but here it's frozen. I wanted to say that from 2007 to 2026, we know this outbreak, there is no vaccine. When I flew to Ituri, people were asking me, DG, are you sure that if this outbreak was in some countries, Western countries, will not have vaccine and medicine available? This is why we are saying it's time for us to move on. Your Excellency, with your permission, I will bring for 2 minutes someone who's working with us on vaccine. This is the CEO of CEPI, Richard Hatchett, just to explain, before I conclude, what is the hope that we are bringing for vaccine here. Richard, please, you have 2 minutes quickly.
Sure. Thank you, DG. Excellencies, esteemed, please consider all protocol. I will speak directly. We regard the situation in Eastern DRC with the gravest concern. The doubling of confirmed cases in the last 10 days is alarming, and we stand in full solidarity with the governments of the DRC and with Africa CDC and with the health workers and communities on the front lines of this terrible outbreak. But I want to speak not only about the crisis before us, I want to speak about the future that we are building together. Excellencies, safe and effective vaccines are coming. CEPI has committed more than $60 million of our own resources to accelerate vaccine candidates for Bundibugyo virus. And the European Commission and the United States have committed an additional $135 million to our efforts. We anticipate our Oxford and Moderna lead candidates entering phase 1 trials as early as July, with field trials possible within several months. The 4 vaccines illustrated on this slide are the first 4 candidates. We will soon announce our support for additional candidates. We will need your support and the support of African institutions to make this rapid development possible. CEPI's long-term mission, the 100 days mission, is to compress the time from outbreak identification to vaccine deployment to 100 days. We are not there yet, but we are closer than we have ever been, and this outbreak will drive progress toward that goal. We are committed to ensuring that safe and effective vaccines are developed in this crisis and that they are available without delay to those most in need. And we are committed to African vaccine sovereignty. African scientists, African manufacturers, African institutions must be partners in building this capacity, not just recipients of it. They will join us in developing vaccines for the protection of the African people. We mourn the lives lost, we stand with you, and we will not stop until this threat of Bundibugyo is defeated. Thank you, DJ.
Sorry, you are muted. You are muted, Dr. Kasi.
Votre micro n'est toujours pas allumé, Dr. Kasseya.
Bon, maintenant, vous m'entendez? Je parle avec le micro de l'ordinateur.
Oui, nous vous entendons, mais avec l'écho.
Alors, nous disons que notre continent, attendez, je vais arrêter ça. Ce micro-là, il est allumé. Vous m'entendez maintenant? Vous m'entendez?
Oui, nous entendons.
Merci. Donc, je disais...
Il y a toujours cet écho.
Voilà, je disais que notre continent fait face déjà à des restrictions de voyage. Nous avons déjà 20 pays qui imposent des restrictions et même certains pays africains qui n'ont aucun cas, comme le Kenya, comme le Rwanda, comme le Sud-Soudan, sont dans les listes. Nous ne voulons pas que cette tendance continue. C'est pour cela Africa CDC avait déjà publié des guidelines pour que nos pays puissent rapidement mettre en place les mesures pour rassurer aussi bien nos communautés propres, puisque nos dirigeants, c'est pour d'abord notre propre population, mais aussi nos partenaires. Et donc, pour cela, nous avons demandé que chaque pays puisse utiliser les formulaires qu'on a envoyés, que nous sommes en train de coupler avec un QR code pour savoir qui entre, qui sort et quels sont ses symptômes. Nous avons aussi publié un guide pour dire que l'OMS Africa CDC n'encourage pas les restrictions de voyage. Pour le moment, nous voulons continuer à faire des réunions, à faire des voyages, mais en se protégeant, en étant sûr qu'une personne qui voyage pour une réunion ou pour d'autres raisons personnelles n'est pas un risque pour la communauté. Excellence, celui-ci est mon dernier slide. Au chef d'État, on ne demande pas plusieurs choses à la fois. Nous ne demandons que 5 choses, Excellence. La première, je vous ai présenté la situation à Goma. Je vous ai dit aussi qu'il y a l'insécurité à Ituri. Nous vous demandons si vous pouvez nous aider à prendre une décision aujourd'hui pour que Africa CDC, l'OMS et d'autres partenaires, nous puissions avoir accès là-bas. Je voudrais bien aller à Goma, mais j'ai besoin que vous puissiez, comme Africa CDC, c'est une organisation des États membres, que vous puissiez me dire comment faire pour y aller et comprendre ce qui se passe. La deuxième chose, nous voulons remercier toutes les contributions. Nous avons reçu maintenant aujourd'hui la contribution des 13,5 millions d'Afrique du Sud que nous remercions. Nous avons reçu 30 tonnes d'équipements et matériels divers de l'Égypte. Hier, ils m'ont donné 30 tonnes. Je remercie l'Égypte pour ça. Nous avons reçu le président de la Guinée-Bissau, le président de l'Angola. Comme ils vont parler, je vais leur laisser l'opportunité de dire ce qu'ils nous ont déjà donné. Et comme le tiers l'a dit, l'objectif, c'est d'avoir au moins 100 millions de dollars venant de l'Afrique. Le troisième accès que nous vous demandons, c'est d'appliquer les guidelines que nous avons proposés. C'est à votre pouvoir de dire que nous commençons à mettre ça en œuvre. Le quatrième, c'est que nous puissions faire adhérer nos pays dans les African Pool Procurement Mechanism. C'est ce mécanisme qui va nous permettre des achats groupés et le président de Botswana qui va parler va vous dire combien le Botswana a souffert pour ne pas avoir à faire partie de ces achats groupés puisque ça coûte trop cher et il y a beaucoup de middlemen qui prennent trop d'argent. Le dernier, c'est l'Agence de médecine africaine. Nous devons tous adhérer à l'Agence de médecine africaine pour s'assurer que nous avons des mécanismes de régulation qui sont forts. Excellence, c'était mon dernier slide. Je vous remercie beaucoup. C'est plutôt des slides de plaidoyer que nous avons fait aujourd'hui. Merci beaucoup.
Merci, monsieur le DG de Africa CDC pour votre présentation. À présent, nous voudrions écouter les messages de solidarité de la part des chefs d'État des pays membres de l'Union africaine. Ici, je commence par Son Excellence Lorenzo, président de l'Angola. Angola, c'est votre tour.
Muito obrigada, Excelências. Nós tivemos Tua Excelência Presidente João Lourenço, teve uma sobreposição da agenda. Não sei se me estão a ouvir, Excelências. Sim. Queríamos pedir as nossas sinceras desculpas. Sua Excelência Presidente João.
Nous présentons nos sincères excuses.
Excelência Presidente João Lourenço teve posição da agenda incumbindo a nós, como Ministra da Saúde, para apresentá-lo neste momento. Sua Excelência Evariste Ndayishimiye, Presidente da República do Burundi e Presidente em exercício da União Africana, Sua Excelência Cyril Ramaphosa, campeão da União Africana para a preparação e prevenção da resposta às pandemias, Excelências, chefes de Estado e de Governo, Sua Excelência António Guterres, secretário-geral das Nações Unidas, Sua Excelência Mohamed Ali Youssouf, presidente da Comissão da União Africana, distintos parceiros de desenvolvimento, minhas senhoras e meus senhores. Queríamos também aqui cumprimentar o Dr. Jean Kasseya, o diretor-geral do CDC África. Felicito Sua Excelência, Presidente Evariste Dzansishimini, pela oportuna iniciativa de convocar a reunião de alto nível. A gravidade da conjuntura atual impõe que o continente africano reitere a sua capacidade de atuação concertada, solidária e resoluta perante uma ameaça direta à segurança sanitária e à integridade dos nossos povos. Acompanhamos com a devida reserva e atenção a atualização epidemiológica apresentada pelo diretor-geral do CDC África. Os dados partilhados evidenciam a complexidade operacional da resposta em curso e o risco iminente de uma propagação transfronteiriça. Este cenário exige das nossas lideranças uma firmeza política inabalável, coordenação estratégica centralizada, célere mobilização de recursos. Desde a sua identificação, em 1976, o continente africano tem enfrentado crises epidemiológicas cíclicas provocadas pelo vírus do Ebola, as quais testam a robustez dos nossos sistemas de saúde e a estabilidade das nossas economias. A presente epidemia recorda-nos que a segurança sanitária deixou de ser apenas uma questão de saúde pública. É hoje uma questão de soberania, de estabilidade econômica, de paz e segurança continental. Contudo, estas adversidades consolidaram a nossa resiliência coletiva e a capacidade de superação através da liderança partilhada, do engajamento comunitário, da cooperação mútua entre Estados africanos e os seus parceiros estratégicos. A pandemia da Covid-19 demonstrou de forma inequívoca que a segurança sanitária constitui uma vertente fundamental na soberania nacional, indissociável da estabilidade política e do desenvolvimento socioeconômico. Relembrou-nos também que nenhuma fronteira isolada por si só, uma ameaça biológica, permanecendo a prevenção ativa e a solidariedade internacional como um dos mecanismos mais eficazes para a proteção das populações. O surto atual da variante Burundi afeta diretamente a República Democrática do Congo e a República de Uganda, numa região de extrema mobilidade populacional e fluxos comerciais intensos. Esta dinâmica eleva o risco de disseminação regional para a República de Angola, que partilha uma vasta fronteira porosa da linha fronteiriça com a RDC. A situação requer um estado de prontidão permanente. Aos presidentes Félix Antoine Tshisekedi e Museveni manifesto a total e incondicional solidariedade do Estado angolano. A vossa batalha é a batalha de toda a África. Permitam-me prestar uma sentida homenagem aos profissionais de saúde, trabalhadores comunitários e a todos aqueles que se encontram na linha da frente da resposta nas áreas afetadas. Excelências, saúde os Estados-membros que já mobilizaram apoio concreto destacando os contributos financeiros da África do Sul, República do Egito, República da Guiné Equatorial, cujos gestos merecem o nosso reconhecimento público. Apelo a que mais nações sigam este exemplo de responsabilidade partilhada. Angola reafirma aqui o cumprimento integral da sua contribuição voluntária de 5 milhões de dólares a favor do CDC e insta os parceiros de desenvolvimento a converterem as suas manifestações de solidariedade em apoio orçamental direto ao Plano Conjunto de Preparação e Resposta, co-liderado pela Organização Mundial de Saúde. Procedemos à atualização do Plano Nacional de Contingência Multissetorial de Prevenção, Preparação e Resposta à Doença por Vírus do Ebola, em alinhamento com o Plano Continental do África CDC e da Organização Mundial de Saúde. Reforçamos a vigilância epidemiológica e laboratorial, a prontidão das equipas de resposta, a vigilância sanitária nos pontos de entrada, a formação de profissionais de saúde e de setores estratégicos do Estado, bem como a realização de exercícios de simulação e ações de comunicação de risco e envolvimento comunitário. Determino a urgência dos Estados-membros intensificarem a partilha de dados epidemiológicos, a sequenciação genômica em tempo real sob a coordenação do África CDC. A omissão ou atraso na transmissão de dados estatísticos resulta na perda irreparável de vidas humanas. Sobre a égide da nossa Autoridade Sanitária Nacional, Angola reforçou os mecanismos de vigilância epidemiológica nas províncias fronteiriças de Cabinda, Zaire, Uís, Malange e Lunda Norte, mediante o desdobramento de equipas de resposta rápida e laboratórios de campanha ativos. O agente patogênico ignora limites geográficos, pelo que as nossas diretrizes de contenção não podem subsistir fragmentadas, defendendo a harmonização imediata dos protocolos de biossegurança e o controle sanitário integrado. Para o efeito, Angola operacionalizou um sistema rigoroso de rastreio em todos os pontos de entrada no território nacional, com especial incidência fronteiras terrestres e nos aeroportos. É imperativo aplicar estas metodologias de diagnóstico precoce, garantindo o normal funcionamento e o cumprimento integral da agenda das nossas organizações regionais e continental, protegendo a saúde pública sem estrangular o comércio legítimo, evitando barreiras unilaterais que penalizam as economias locais. É por isso que esta crise deve acelerar a nossa agenda de soberania sanitária. Devemos fortalecer a investigação científica, expandir a produção local de vacinas, medicamentos e meios de diagnóstico e reforçar as capacidades africanas de resposta às emergências de saúde pública. Adicionalmente, recordo que o medo e a desinformação potenciam a letalidade do vírus, gerando desconfiança institucional nas comunidades. É imperativo integrar as lideranças tradicionais e religiosas nas ações de comunicação de risco, garantindo que as populações colaborem ativamente com as autoridades de saúde na identificação precoce de casos suspeitos. Excelências, a janela de oportunidade para circunscrever e neutralizar esta variante é exígua. Cada dia de hesitação ou desconexão institucional agrava o risco de uma emergência de saúde pública de impacto continental. Exorto aos presentes a atuar com sentido de urgência e a autoridade que a situação requer. A África possui competência técnica e determinação política necessárias para mitigar e vencer o desafio. Muito obrigada pela vossa atenção.
Merci beaucoup. Maintenant, c'est le tour de Son Excellence le Président de la Guinée équatoriale.